The world has just begun to recover from the COVID-19 pandemic. The scars it left behind are still fresh, and the memories of lockdowns, social distancing, and the overwhelming loss are etched in our minds. We are still picking up the pieces, still mourning the losses. Families are grieving loved ones, communities are trying to rebuild, and the global economy is slowly finding its footing again. But a shadow hangs over us. The fear of another pandemic looms large, casting a pall over our collective sense of security and well-being. The UK Health Security Agency has issued a stark warning. Their experts have been closely monitoring the situation, analyzing data, and studying patterns. They believe another pandemic is not just possible, but likely. The scientific community is on high alert, working tirelessly to understand and predict the next potential outbreak. And it could be even worse than COVID-19. The potential for a more virulent and deadly virus is a real and present danger. The world held its breath as COVID-19 swept across the globe. It disrupted lives, economies, and the very fabric of society. It seemed to come out of nowhere. One moment, life was normal. The next, everything changed. Businesses shuttered, streets emptied, and a sense of fear and uncertainty took hold. But viruses are always evolving, always adapting. They are nature's way of reminding us of our vulnerability and the need for constant vigilance. And new viruses are emerging all the time. From wildlife markets to remote corners of the world, the potential for new diseases to jump from animals to humans is ever present. The UKHSA is sounding the alarm. They are urging governments, healthcare systems, and the public to take this threat seriously. We need to be prepared for the next pandemic. This means investing in healthcare infrastructure, supporting scientific research, and fostering a culture of readiness and resilience. The lessons learned from COVID-19 must guide our actions as we brace for what may come next. The UKHSA uses a chilling term, Disease X. This refers to a completely unknown pathogen. It is a disease that has never been seen before in humans. Disease X could emerge from anywhere. It could come from animals, insects, or even the environment. The threat of Disease X is very real. We live in a world where humans are encroaching on nature. This brings us into contact with new viruses all the time. Most of these viruses are harmless to humans, but some have the potential to be deadly. One virus that has caught the attention of the UKHSA is a measles-like virus. Measles is already highly contagious, but this new virus is even more so. It spreads through the air with frightening ease. Just like measles, it could quickly become a global threat. The symptoms of this new virus are similar to measles. Patients experience fever, cough, and a rash. But there is one key difference. This new virus is much more deadly. It attacks the respiratory system, leading to pneumonia and even death. The Picornaviridae family of viruses is another concern. These viruses are known to cause a range of illnesses, from the common cold to polio. One particularly nasty member of this family is the virus that causes acute flaccid myelitis. This disease attacks the nervous system, leading to paralysis. AFM is a rare disease, but it is on the rise. In recent years, there have been outbreaks in the United States, Canada, and Europe. Scientists are still trying to understand why, but what they do know is that AFM can have devastating consequences. The Paramyxoviridae family of viruses includes some well-known names like measles and mumps, but it also includes some lesser-known viruses like the Nipah virus. Nipah virus is a deadly disease that can be spread from animals to humans. It causes encephalitis or swelling of the brain. The Nipah virus first emerged in Malaysia in 1998. It caused a large outbreak in pigs, which then spread to humans. Since then, there have been several other outbreaks of Nipah virus in South Asia. The virus is highly contagious and has a high mortality rate. Measles is a highly contagious disease that was once thought to be under control. Thanks to vaccination, measles cases had plummeted. But in recent years, measles has made a comeback. This is due to a number of factors, including vaccine hesitancy and misinformation. Measles is not a harmless childhood disease. It can cause serious complications, such as pneumonia, encephalitis, and even death. The resurgence of measles is a serious public health threat. It is a reminder that we cannot take our health for granted. Bird flu, or avian influenza, is a virus that primarily affects birds. It is found in both wild and domestic bird populations, spreading through direct contact with infected birds or contaminated environments. Wild birds, especially waterfowl, often carry the virus without showing symptoms, acting as reservoirs for the disease. However, certain strains of bird flu have the potential to infect humans. This cross-species transmission is rare, but can occur when humans come into close contact with infected birds or contaminated surfaces. The virus can mutate, increasing the risk of human infection. This is a serious concern, as bird flu can be very deadly to humans. Symptoms in humans can range from typical flu-like symptoms, such as fever, cough, and sore throat, to severe respiratory illness, pneumonia, and even multi-organ failure. The high mortality rate makes it a significant public health threat. In recent years, there have been a number of outbreaks of bird flu in poultry farms around the world. These outbreaks often lead to the culling of millions of birds to prevent the spread of the virus, causing significant economic losses and impacting food security. The H5N1 strain of bird flu is of particular concern. First identified in 1997 in Hong Kong, it has since spread to many countries. This strain is highly virulent and can cause severe disease in both birds and humans. This strain is highly pathogenic to birds and can also infect humans. The virus can survive in low temperatures and remain viable in contaminated environments for extended periods, making it difficult to control. H5N1 has a high mortality rate in humans. Approximately 60% of reported human cases have resulted in death, highlighting the need for vigilant monitoring and rapid response to outbreaks. The World Health Organization, or WHO, is closely monitoring the situation. They collaborate with national health authorities and other international organizations to track the spread of the virus and assess the risk to public health. They are working to develop vaccines and antiviral drugs to combat bird flu. Research is ongoing to create effective vaccines that can be rapidly produced and distributed in the event of a pandemic. Antiviral drugs are also being tested to treat infected individuals and reduce the severity of the disease. The global nature of bird flu outbreaks underscores the importance of international cooperation and preparedness. Rapid detection, reporting, and response are crucial to preventing the spread of the virus and protecting public health. Public awareness and education are also key components in the fight against bird flu. Communities need to be informed about the risks and preventive measures, such as avoiding contact with sick birds and practicing good hygiene. Farmers and poultry producers play a critical role in controlling the spread of bird flu. Implementing strict biosecurity measures, such as controlling access to farms, disinfecting equipment, and monitoring bird health, can help prevent outbreaks. The fight against bird flu requires a coordinated global effort. By working together, sharing information, and investing in research and preparedness, we can reduce the threat of a bird flu pandemic and protect both human and animal health. Experts around the world are echoing the UKHSA's warnings. Mark Woolhouse, a professor of infectious disease epidemiology at the University of Edinburgh, has said that the next pandemic could be just around the corner. Professor Isabel Oliver, the chief scientific officer at the UKHSA, has warned that we are in a race against time to prepare for the next pandemic. The scientific community is united in its concern. They know that it is not a matter of if, but when, the next pandemic will strike. They are working tirelessly to understand these emerging viruses. They are developing new tools and technologies to fight them. The UKHSA has developed a new tool to help prepare for the next pandemic. This innovative approach is designed to give us a head start in identifying and combating potential health threats before they become widespread. It is called the UKHSA Horizon Scanning Tool. This tool represents a significant leap forward in our ability to foresee and mitigate the impact of future pandemics. This tool uses artificial intelligence to scan for potential pandemic threats. By leveraging the power of AI, it can process vast amounts of data at unprecedented speeds, identifying patterns and anomalies that might indicate emerging health risks. It analyzes data from a variety of sources, including scientific journals, news reports, and social media. This comprehensive approach ensures that no potential threat goes unnoticed, providing a holistic view of the global health landscape. The UKHSA Horizon Scanning Tool is a vital new weapon in the fight against pandemics. Its ability to provide early warnings can make the difference between a contained outbreak and a global crisis. It will help us to identify potential threats early on, Early detection is crucial, as it allows health officials to implement containment measures swiftly and effectively. This will give us more time to prepare and respond. With advance notice, we can stockpile necessary medical supplies, train healthcare workers, and develop strategic response plans. We need to invest in research, surveillance, and public health infrastructure. Continuous investment in these areas is essential to maintain our readiness and improve our response capabilities. We must remain vigilant. The next pandemic could be just around the corner. History has shown us that pandemics are inevitable, but with the right tools and preparation, we can mitigate their impact. But if we are prepared, we can minimize the damage. We can save lives. Preparedness is not just about having the right tools, it's about having the right mindset and being ready to act swiftly and decisively when the time comes. Public awareness and community engagement are also critical components of our preparedness strategy. Educating the public on preventive measures and encouraging proactive health behaviors can significantly reduce the spread of infectious diseases. Global collaboration is another key element. Pandemics do not respect borders, and neither should our efforts to combat them. By working together with international health organizations and sharing information, we can create a united front against potential threats. The development and distribution of vaccines are paramount. Rapid vaccine development and efficient distribution channels can turn the tide in our favor, protecting millions of lives and restoring normalcy. Training and preparedness drills for health workers ensure that they are ready to respond effectively. Regular training sessions and emergency drills help keep skills sharp and response times quick. Simple preventive measures like good hygiene, wearing masks, and maintaining social distance can have a profound impact. These practices, when adopted widely, can slow the spread of disease and buy valuable time for health authorities to act. Strategic planning and policy implementation are the backbone of our preparedness efforts. By continuously reviewing data and refining our strategies, we can stay ahead of potential threats and ensure a coordinated response. Ultimately, community resilience and support play a crucial role in overcoming pandemics. By fostering a sense of solidarity and mutual aid, we can emerge stronger